Hi, this is Donna. Thank you so much for joining me today. I am talking to nurses about working from home. And so, on this video, what I'm going to do is give about 10 points to look at to see if a remote nursing job is right for you. And I always want to first give glory and honor to God because without God, I can't do anything. And so we're going to go through these points and it'll give you the opportunity to look and see, just examine, is this something for me? Is it right for me? I can tell you when I first heard about nurses working from home, I just knew it was for me and I started researching and finding out more information. And I'm going to go over these 10 points with you, and it will answer a lot of questions I'm sure that you thought of and didn't ask, or maybe you tried to ask and no one really answered for you. The number one question that everyone has is, what about the pay? What about the pay? Because previously, before remote nursing was popular, nurses actually were paid less than what you would get in a hospital setting or a doctor's office. But now the pay is about the same as you would get working in the hospital or any other facility, and a lot of positions are actually paying higher than what you would get. So for me, I'm an RN and I am in Texas. I have an associate's degree. And when I was working in the hospital, I was making $47 per hour. And I just recently found a couple of positions that I qualify for that are, they're at 100,000 per year. And so when I was making the 47 per hour, that's like 97,000 annually. And so these positions are actually higher than what I would be making in a hospital setting. And so that is great news to me because getting paid very well and not doing patient care and being at home, not commuting, those are some good pluses. So I give the pay a big thumbs up. Secondly, who is remote nursing for? Now, you're going to hear me say remote nursing, virtual nursing, because those are all terms that are related to the same thing. It's basically a nurse working from home. And you may hear someone refer to it as virtual nursing or remote nursing. But it is available for RNs, whether you have an associate degree, bachelor's or master's, LVNs, LPNs, physician's assistants. There are positions available for every level of nursing, every degree of nursing. And there are job postings every single day across the U.S. That is really something. The third question that I'm going to answer is, what experience do nurses have to have? Surprisingly, there is no additional education or training required. Many of the positions are on the job training. And so basically what you have to have is at least 2 years of nursing experience. And again, the good part about that is the nursing experience can be in any area of nursing, whether it's med-surg, home health, ICU, ED, any of those areas. There are positions available. Kind of lost my train of thought there for a moment. Okay, we're going to move on to the next one. What do nurses do in remote settings? In your home setting, what do nurses do? There are basically two different type of roles for a nurse. One of them is where you're just specifically working with medical records only. You're just simply looking at medical records. And then the second type of position is where you're looking at medical records, but you're also interacting with clients, not in a bedside manner, but you're making calls, Sometimes nurses have to go and do a visit, like do an assessment, where they're just gathering information. But those are the two type of roles where it's either just medical records or medical records and interacting with patients. And you also have to interact with physicians. You may interact with other nursing staff. And so I don't know how that sounds to you, but it sounds wonderful for me. Wonderful, wonderful to me. No bedside care, no running up and down halls, just records or just talking to people on the phone. I can do that. The fifth thing we're going to look at, fifth question we're going to look at, that people have asked is, where are the jobs? And surprisingly, there are remote jobs in every state. Every state. And then there are some jobs where you can be living in one state, but the company you work for is in a total different state. And so the position that I'm waiting to hear back from, they're actually in Missouri. And so, like I said earlier, I'm in Texas. And so I have a compact license, and it would be good if you get a compact nursing license. That way you can work in any of the states that are under that compact license. The next point that is often asked about is, what is required in your home? What do you have to have in order to qualify for a work from home position? You do have to have a area that is distraction free in your home, or either an office space. It doesn't have to actually be an office space or a room specifically, but it does need to be a quiet place that is distraction free. And distraction free means basically, if someone has children that are small, it would not work out well because you have to make phone calls, and then sometimes there are meetings that you have to do, and so you do have to be very focused and detailed in your environment. Okay, I'm going to talk just a minute about the internet, because that is a big item. For remote jobs, you do have to have high-speed internet, and it has to be hardwired. And so this one position that I was called about, they actually wanted me to do a speed test for my internet, and I had to do that to even apply for the job. And so if you want to test out your internet, you can go to speedtest.net. That's one of the sites you can go to, and you just click and it will test your internet for you. Okay, the next item we're going to look at is, what is it like working from home? So basically, the day is spent looking at records, reading data, putting in assessments. It could be team meetings. Sometimes there are meetings, depending on what company you work for. It could be daily meetings, it could be weekly meetings, it could be quarterly meetings. But you do have to, of course, if you're going to do a meeting, you want to dress professional. I'm dressed more relaxed today, but if it's a meeting, you want to dress professional because everyone's going to be able to, see each other. Okay, and then next, who hires nurses to work from home? Insurance companies, hospitals, staffing companies, care management companies, assisted living, nursing homes. It's a lot of different companies hire virtual nurses. Now you just use the term virtual nurses. Okay, the next question that I'm going to answer is, that people normally ask is, what is the process? And so this is where you have to really look and see if you see some value in it. I saw value in working from home. The process usually takes, on average, it could be 3 to 6 months. Sometimes it can take up to a year before a nurse actually gets a job offer, a solid job offer. And so it would be good if you planned it out. Even a nurse that is just graduating, if you decide, in a couple of years, I think I would like to have a work from home position, you can certainly start working on that process and just get your experience together and be ready to apply. Now, if you're a nurse and, let's say you are like, yes, I need to make a change. You want to stay where you are right now and then find out how the process works. And so that way, while you are waiting for a job offer, waiting for an interview, waiting for that first call, you're still making money. The last topic I'm going to cover is how to get started. Now, again, there are a lot of remote nursing positions out there. There are so many, but it is a process. There are some things you do need to know. And so I am putting together a course that teaches nurses how to go step by step to get those job offers. And so if you want to be notified when the course is available, you can send an email. Down in the description section, I have an email that you can just respond to and let me know that you want to be notified when the course comes out. Also, it's important to realize that there are a lot of jobs out there, but if you don't know the process, it will be much more challenging to get a job offer. I did not understand the process at first, and I was applying for jobs for about a year, and I didn't even get not one phone call because I didn't understand exactly how it worked. But now that I do understand, now that I know the process, now that I know exactly what it takes, I have a couple of job offers. I'm going through a process right now where I'm going to choose which position that I really want. And that's the good news is once you understand the process and you start applying for jobs, you will most likely get to kind of pick and choose, well, I think I want this one more than I want that one, whichever one works best for you. And so again, if you are interested in, if this is for you, because it may not be for everyone, if you are ready to use your nursing knowledge and experience in a different way that does not involve patient care, if you are ready to go to a more quiet setting in your home, because it is a quiet setting, then it could be a good fit for you. And so again, I will be offering a course. I will also be doing coaching, and my email is below the video. And if you're interested in coaching, you can contact me and I'll be glad to talk to you about it. And I hope this video has helped you to really understand better what remote nursing is all about and help you to understand that it is for you. If you want it, it's definitely for you. If it works for you, being at home in a quieter setting, getting paid the same amount of money, it would be a good fit for you. Thank you so much for joining me today.